All right, truth be told, I am excited about today's episode. Truth be told, you can tell what we're going to talk about today. Welcome to Ask Your Doctors. Welcome to another Wellness Wednesday. I am Dr. K. And I am in the comfortable presence of another colleague and friend of mine. Look, you should be able to figure it out. It's very easy to get a dentist for this topic, but I chose the best. I chose a colleague that is very, very eager on health messaging. I chose a colleague with whom we should have done this a long time ago. I've been in the industry 25 years, and when I was back in Kwakwa, we actually set up a community radio station, and guess who dominated the health messaging episodes there? I even sponsored a show on oral health. So we have none other than Dr. Odirile Moloi. Welcome, bro.
Thank you, my brother. Thank you for having me. Yeah.
Thanks for making the time.
Yeah.
Okay, sharp. So we will try not to stray too much into our friendship things. We will make it...
that can take a long time.
Yeah, no, too much. We can do this after the show. Yeah, so what we will do is we will be telling you about the relevance of the landmark day, that is the 20th of March, whereby it is International Oral Health Awareness Day. That is why we're having today's episode. And thank you for joining us. Now, without wasting any time, Doc, tell us about your background. Tell us about your background in dentistry, and let's get to it.
Oh, yeah. As Doctor mentioned, my name is Dr. Odirile Moloi. I'm from Rustenburg, Klaban. And I think...
Rustenburg? I thought it was Pitur.
Never. Pretoria. Pretoria's work, yeah. I'm a rusty, dusty guy. So
okay.
I think from there came to Medunsa at the time to study dentistry. That's why, the Pretoria thing, I completed there. Now I'm in private practice in Louis Pasteur Hospital. We've been there from 2008, I think. But obviously we've been practicing for a while before then. I would say about, how many years now in private practice?
There are too many.
Yeah.
There are many.
Yeah. But I think, if you ask me how I got into this thing, it's a very interesting story. And I love to share the story.
Please do.
Coming from Rustenburg, we love gold teeth. All my peers had gold teeth. And I went to the dentist. I probably was about 13, 14. And I went to a dentist to say, hey, I'm here to get a gold tooth. And they booked an appointment for me for a Saturday, because I was in school. When I went the Saturday, I found this dentist, and it later made, I later became aware that definitely must have been a locum dentist, because instead of her prepping that gold filling, she said to me, no man, you've got a beautiful smile. Don't do this. Rather, let's clean your teeth. Let's show you what else we can do. Don't put jewelry on your teeth yet until you're older. And I just loved the environment, and I looked at everything, and I've always wanted to be a doctor. But that day, I decided, with this cleanliness, this neatness of, the whole environment, I was like, this is what I'm doing. And to this day, I can't find that lady, because she was a locum there at that practice. And, such made me where I am now.
There you go, guys, inspirational stories.
Yeah.
We aspire to inspire on this show. So if you are a young man, young woman out there, and you want to know how you can follow your dreams, sometimes do send us a message on our website, send us a message on our social media pages. Just say to us, guys, I want to study this. Safe to say, we have received messages on my dental social media pages, even about people that are looking for jobs. You never know what could come up. Yeah, Doc, so why is dental health important for us to be talking about? Forget the day that we are celebrating.
Look, dental health is important, and I'm so happy that I'm here with you as one that shares the same sentiments as me. Dental health and oral, I prefer to call it oral health, because dental forms part of oral health, and oral health not only involves the teeth, but it involves the oral cavity, the tongue, everything else that has to do with that. And for us, it's extremely important, because as we all know, the mouth is the window to your whole body. And everything you eat, everything you like speaking is through the mouth, through the oral cavity. Now, that helps a lot in terms of speaking, chewing food, in terms of tasting the food, swallowing, facial expression, such things. They are so important, and it forms part of your whole body as well, you know. So oral health, you know, for me, carries the same weight as your normal, you know, health. And it's just as important, and we need to take it seriously because of its significance there.
We can transmit germs from the mouth to the rest of the body. We can recognize from the mouth what we see, what could be going on in the rest of the body. And if you do not, but they say you are what you eat. Definitely. But if you can't eat because you have maybe malfunctioning, chewing or whatever, there's a problem there. So I agree with you.
And interesting you say that, because as dentists, we are the ones who would pick up many of the diseases or illnesses first in the oral cavity before our colleagues in other fields can pick it up. The dentist would say, okay, in the mouth you see these type of lesions, they are associated with this type of disease. And it's not as evident, like this person didn't go to the doctor for a checkup or anything, but just at the dentist you can pick them up and say, hey, this lesion or this problem is associated with this medical condition. Please get it checked out.
Can you give us examples then?
There's quite a lot. Diabetes, for example, that fruity smell.
Yes.
You can figure that out. And our HIV and AIDS, there are certain lesions in the tongue, in the oral cavity that you can pick up from there, you know, and many other cancers can be picked up in the mouth, you know, such things, yeah.
And we are trained counselors for HIV counseling. So we do not stigmatize when we pick up these things. It is your pathway. We are part of your journey. If we pick it up, then we stop right there and say, listen, do you want me to do more tests so that we can put you on treatment much sooner than later? And diabetes, you said fruity smell. Can you elaborate on that?
As you know that with diabetes, you have an increased level of sugar in your blood.
Yeah.
So that also comes into the saliva.
Yeah.
And that's where you can pick it up. And as you know, with the sugar, it becomes, when it gets excessive in the oral cavity, that's when you start suffering from a whole lot of other dental problems that are very interesting, and we should actually discuss those because they're quite important.
Like when you have diabetes, your ability to fight disease is compromised.
Definitely compromised, yeah.
So your gums will succumb to the normal flora in a more extreme way than it should happen.
Yeah, look, with so much so much sugar in your saliva as well, you know that this sugar aids the bacteria to grow. It's a playing field for bacteria to grow.
And yeast.
In your oral cavity, turning into acid. This acid will then demineralize the hard tissues of your teeth, which is the enamel and the dentine, causing these cavities. So people always ask, how does diabetes affect my oral health? So like you mentioned, the inability to fight disease, too much sugar content in the saliva will demineralize that, causing that. Also on the gums, it plays a huge role in gum health. You know, the gums they can deteriorate because of the diabetes as well. Low immune system as well. The production of saliva, people start complaining of a dry mouth, which if there's a dry mouth, then there's itchiness of the mouth, there's itchiness of the tongue, there's, you know, the bad breath from no much saliva being produced, and also the, you know, the gum and the periodontal problems, they get worse, yeah.
Periodontal problems meaning the disease that can affect the surrounding tissues of the tooth, which is the bones and the gums.
Yeah, so here's the thing. With gingivitis, most of these problems are limited to the gums. You get the redness, the inflammation, the swelling, the bleeding. Most of the time it can be painless. But when not treated, it will turn into periodontitis, which now, like you mentioned, it starts involving the surrounding tissues, which is the bone, the supporting ligaments of the teeth to the gum or to the jawbone, and, you know, causes the teeth to be actually.
And how do we prevent that? Just in short.
Prevention, Doc, prevention.
How do we manage the situation if it prevails?
Okay, prevention starts with good oral hygiene techniques at home, which means we always encourage our people to brush their teeth twice a day, floss the teeth regularly, get correct techniques of brushing the teeth. Also, very importantly, visiting the dentists where these problems will be picked up, these problems will be discussed, correct technique of brushing the teeth. Because you and I know, in our experience as dentists, every patient we get, they will swear to you that, look, I brush my teeth every day, but what if the way you brush in your teeth is incorrect? That's why it's important for you to visit the dentist, the dental therapist, the oral hygienist. They will teach you, educate you how to look after the teeth and show you the correct techniques of doing it, flossing, brushing properly, encouraging you to come in every 6 months for such.
They can even YouTube the techniques.
Look, for me, YouTubing the technique, it's more like Google Doctor.
Yeah.
You still need to sit with a professional because
I'm not saying as a replacement. I'm saying, just to remind themselves.
Definitely.
Okay.
Yeah.
While they're YouTubing, they must also see some of our other episodes.
Oh, yes.
And then they must subscribe.
Very interesting. I've been watching many of those and very, very interesting. And I see a lot of people are getting interested in that and watching.
Yeah.
For me as well, I'd rather that when I'm sitting on my smartphone, I enjoy watching YouTube videos and all other things. That's very helpful.
I'm glad it took us only episode 16, whatever, for us to start talking about dentist things, because people would have thought when I tell them we do YouTube stuff, also, is it dentist? I said, no, go in, you will see it's everything,
Yeah.
So children, what's the overarching thing you would say about children? How do we manage their oral health?
We love children, and as dentists, we would love to start seeing children to emphasize the importance of oral health amongst children, because when a child is born, you want to make sure that you educate the parents as well of be on the lookout. When a child is born, are there natal teeth in the mouth? Where a child can be born with 1 or 2 teeth, we will then advise how to manage that, whether we leave it there or for a time being, or we leave it completely, or we remove it with the fear of the child aspirating it. And also growing up.
This is at birth, right?
At birth, yeah. At
birth. By the way, let's debunk the myth. When you read certain publications, they will show a poor child that was born with teeth and they will call that witchcraft. No, it is not witchcraft. It's a condition where the child is perfectly normal. It's just overdevelopment of dental tissue at birth, which is not supposed to be there. So we just extract the teeth and the child is not cursed. So there's no witchcraft there, as opposed to what some newspapers were trying to insinuate. But in any case.
And one of the reasons we end up having to remove the tooth is it usually is not a fully developed tooth. It's just sitting on the soft tissues, which is the gum, and we fear that the child will aspirate it. And you can imagine a newborn having to swallow such a hard tissue can be aspirated, can fall into the wrong areas.
And it can be uncomfortable to the breastfeeding mother as well.
Definitely.
So there's no witchcraft here. It's just a normal a condition that occurs in one in several million children.
Yeah. And also, with the kids, with the children, oral hygiene is important because we educate them. And we don't only educate the child, even the parents and the caregivers. That look, let's look after these teeth because they are a strong foundation for the permanent teeth. They are just as important as the permanent teeth. And let us show you and teach you how to look after them, because also we, in the process, model the behavior. We teach the kids that the dentist is not the place where you go when there's pain and they will not take this big needle and inject you. Because now, you would know this and you would attest that growing up, there was that stigma of people being pushed to go to the dentist. Now, when we start them young, it's easy for us to educate them. It becomes less expensive for everyone as well, because prevention then becomes, a key thing. So it becomes less expensive to look after their teeth, to teach them how to brush well, how to look after their milk teeth going forward, to educate them about exfoliation of teeth. As to, at this particular age, we expect 1 or 2 teeth to be moving out, being exfoliated, and then the permanent teeth come in.
Doc, I am a living example of the things you are mentioning. One, as a child, I had bad oral hygiene. I was exposed to sugar, but I was not brushing as much as I was supposed to. Now that's number one. It's safe to say I started having a toothbrush only at the age of 5. My mother had it hard. She was a mother of 6. And I found it strange that my siblings, older siblings, were actually using toothbrushes. But
to a point where many families, funny you say that, many families in our communities used to share toothbrushes.
Yeah.
Growing up, you know, yeah.
And what's the danger with that?
Obviously, cross-infection, that's a lot. That's the biggest thing, cross-infection.
Sorry to interrupt you. A lot of partners still share toothbrushes.
Hey, they think it's romantic, but it's not.
It's not sexy.
It's not sexy at all. Hey, that's the danger.
Hey guys, Dr. Moloi says it's not sexy to share your toothbrushes as partners. Just to sidetrack, even if you get a viral disease like flu, COVID, whatever, you are advised to change your toothbrush beyond your sickness, because some of the bugs, the microorganisms can still be on your toothbrush, and you reinfect yourself when you are done. But anyway, my childhood stories.
Those stories are important, because the toothbrush bristles carry so much, and people take for granted to always, you know, pre-rinse, look after the tooth. As much as we say keep it for a particular period of time, your toothbrush, depending on the make and the, you know, whatever. But also the whole idea of keep rinsing it and making sure that you keep it clean.
Yeah. In my teens, I went through removal of teeth.
Yep.
In my late teens, I was at vet studying IT.
Yep.
And I went to dental school. I was inspired by dental students to actually study dentistry.
Imagine that.
And I was there for my checkup with a swollen jaw, and one of the tooth either had to be removed or something clever be done. And I was told that it had to be removed. But the courteous way with which they were dealing with me, in a dental hospital where I was a student, no one was paying for any services. And they said to me, you need to brush your teeth better. This is what you can do. Don't eat sugar. That education was done to me in my late teens, not as a 6-year-old.
Yeah.
And I could have saved many of my teeth, but I wouldn't have been a dentist. So guess what? So what happened is the inspiration I got from them, under supervision of their lecturers at the time, I said to them, but why is it that you're treating me differently? They said, this is how it's supposed to be done. And I said, then I always wanted to be a doctor. I always wanted to do something in my community. And I said, I'm going to be a dentist, and I'm going to go back to my community, and I'll practice a few years, and then I'll uplift the standards from what I experienced as a child, and then I'll see what I can do after that. So our stories align.
Similar. Yeah. And you look, with these two stories, I think we should, you know, appreciate the importance of dental education coming from the clinicians themselves, the professionals themselves, the impact we have, not only to treat, but also to inspire. You know, because most of the people are inspired by what they see on Sunset Dentistry, what they do, what they're putting out on their social media. People are all on social media now, and such things inspire somebody to say, hey, I would like to be in that field. When they visit the dentist in the dental rooms, the type of explanation they get, that how we educate them, how we teach them to look after their teeth, that can, like you say, turn into an inspiration to become somebody like that. It's like a teaching of some sort. Yeah.
On this show, we aspire to inspire.
Definitely.
So I hope.
Yeah.
And you know what would have happened in your community. You go back to your old school, and 1 or 2 kids call you. 10 years later, I became a dental technician because of you. Dental assistant because of your talk the other day. So it never ends.
I swear, I had a student. I came across one of my patients who said to me, hey, you know, I was a nurse, and you actually inspired me to become a dentist. I'm actually doing my final year, so whatever year they're in now.
Amazing, man.
And such things move you, and you realize, oh, you're doing good.
Now, I've got similar stories.
Yeah.
Many people contacting you. And people are not selfish. They will come back and tell you.
That's why I'm looking for the dentist. I can't find her. I swear, if I find her, I'll tell her.
Yeah. Now, most of our questions, we answered them without giving credit to our audiences. That the questions come from Facebook and Instagram mainly, and we've received some questions on our website. So, speaking of which, we are a YouTube broadcast at the moment. People must remember to go there and click subscribe. but also on our website, we will save all the details of all the specialists that have been here.
Okay.
So to you guys, thank you for the questions, and we continue to ask them, even though we don't give credit, we know they come from you. Okay, some naughty questions come from there.
As well.
From the crew here, but they're not active these days because we're not talking with Dr. Gaini, you see.
Interesting.
That was, they were on fire when we were talking sex education, but it's fine. I will not reveal everything. Let's talk the other end now. Food, Doc. One question here from social media asks, what kind of food is good for your oral health?
I think that's a very great question, and I'll always say that before you even go to the food, let's put it as food and drinks. First, water. Drink water regularly. That should, that's healthy, and obviously vegetables that have a lot of, vegetables have a lot of minerals and vitamins which definitely help production of saliva, saliva stimulation in the mouth. You have your cheeses and your yogurts, your dairy products that have a lot of calcium and proteins that help the development of teeth. Those are extremely important because they do that. And also, we're not saying that your sugary snacks and stuff are extremely, extremely bad, but you must limit the intake, because we don't want to cut off and say, hey, don't take sweets, hey, don't take snacks. There are very healthy snacks that you can put together, your nuts and your,
And there are healthy snacks that may give you the sugar rush, like fruit.
Definitely.
And but it's also got to do with the frequency.
Yeah.
We don't want people to be zombies walking around, not eating anything that makes them happy. But you can cheat now and then. But remember, it's not a myth that sugar damages your teeth. It does.
Yeah.
So everything in moderation.
Limit the intake,
Yeah. And we meant to, one question from the audience here says, we need to speak about CSI. CSI, I'm not sure if it's crime scene investigation projects, or if it's talking about our community social investment projects. Do you have anything you can mention of what you do with the communities?
Look, for us, and this is something that you also are big at, as how do we get oral health to our communities? Now, we know the government is doing quite a lot to, with primary health care in our communities, hospitals with dental facilities, outreach projects where different dentists go to different schools and establishments to educate our communities about oral health. Also, the water fluoridation project that is taking place in areas which are very distant, very far from the cities. In the past we didn't have such, and obviously this improves over the time. But in the past we used to have people in remote areas who didn't have access to healthcare, and the water fluoridation took place to assist that, because it helps.
Your aeroplane escapades, tell us more about that. You travel to far-flung areas.
Yes, so we work with this company called Flying for Life, and we fly out to this, far areas in Venda. It's quite a stretch. I mean, it's like in the Hamakuya district and all those areas where we reach out and we say, hey, we are here to help the people. We go with a team of health professionals as well, and we do a lot of outreach to get the health out there, to get treatments out there. And because we are limited, we most of the time diagnose and refer to nearby hospitals, and there are situations where we do primary health care, like your simple extractions, your simple cleaning and oral hygiene of the teeth, on the dental part. Yeah.
And all this is done at no cost?
All of this we do it at no cost, no cost at all. And the government is very helpful because they provide the mobile clinics, the mobile trucks, and those help a lot in terms of we can send it out and we can go there and help teach, educate, go into schools. Even, you'll be surprised, even in our townships, even in our cities, we still have to do a lot of that groundwork, and we do that a lot as dentists, and we have to appreciate many of our dentists who do that selflessly with no remuneration.
Kudos to you, Doc, and everyone that's involved, including government, on this. And I'll just mention mine that on our side, if you live in the Deep Sloot area, if you live in the Oliven area, go to our website, contact a branch near you if you think you are being bullied because of your smile. because we have a project at my practice where that's called Sunsets Smiles Against Bullying, where we try and do as much as possible, including installing braces to children who can benefit from that. So we reach out. So if you live in Soweto, if you live in Debunking and surrounding areas, and you would like to be considered for pro bono work, please go to our Sunset Dentistry website, and you also social media pages, which are all Sunset Dentistry on Instagram or what is this? Facebook,
IG, YouTube.
You just go there and just leave a DM that says I would like to be considered. Then our social media team will take it from there. Okay, CSI in terms of crime scene investigation. We can also give answers. When we take X-rays of your teeth,
records.
That is a permanent medical legal record of you. So if you're involved in a plane crash, those X-rays can also be taken after you have passed on from a crash, and we can identify, because the teeth don't bend, and most of the filling materials that we put in the teeth don't bend, so the records will reflect and be a mirror reflection of each other.
Yeah, we call that, sorry to cut you, we call that forensic dentistry.
Yes.
And it applies a lot with what we do in terms of when they do molds for ortho, when they do molds and make teeth models, the dentists, we keep them there for a particular number of years, for a particular period, and even the X-rays we take. And I'll admit, in my years of dentistry, I've been approached more than 5 times to go and to share the information that I have to confirm a person who passed on from either car accident or just some of these things that happen. But I have been approached for that, and it has come very helpful.
Okay. Yeah. So tell me, Doc, we've discussed our CSI project, and we have not mentioned the people that we can't take care of, the people that cannot afford some of the services that we do. Do you think there's room for people who need intervention to get intervention?
Definitely, everywhere. I think that as dentists, in our own right, we need to have, because everyone, like in your practice, you guys are doing the best in the deep sleuth areas with this thing. We as dentists, in my practice, we do a lot of, pro bono work for our patients, and because...
But what about the ground that we can cover? I know we're doing it because we've realized the gaps.
Yeah.
Do you think more can be done for
Definitely,
oral health
I believe more should be done for oral health to be covered. We have a lot of people we have a lot of suicide cases, and this is a sensitive topic that takes place because of, like you say, bullying, people who can't smile, people who don't have self-confidence, people who can't afford going to the dentist. Now, our government needs to come in there and say, hey, let us increase our services we offer in these facilities we have. Let us train more dentists. Let us, encourage, oral hygiene and take dentistry as serious as it should be.
It should be.
Yeah.
Have more programs like ours, more programs
Definitely.
by government that actually commemorate important days about dentistry, and make every day a commemorative day for dentistry or something like that.
Definitely.
I know I'm sounding political, but...
No, but the work that you guys are putting must be shown out, that the government needs to say, hey, look, we see what you guys are doing. We would like to celebrate Oral Health Month with you. It's coming up in September. Yeah. We would love to be a part of that. We see what you guys are doing on your programs. We would like to invite you on national television and speak about these sort of things. It goes a long way, because how do you find people? We find them on social media and glued to their TVs, because this is the type of content we need to be showing instead of the other stuff.
Speaking of September and what needs, what people could look forward to, we actually have on the program this show cases that we are documenting from various practitioners that are willing to share their work with us, and various patients that have volunteered their cases to the betterment of society and science, to say they must look forward to mind-blowing transformations. So you guys out there, September is going to be exciting as far as dentistry is concerned.
Can't wait to watch as well.
Yeah. Doc, can you tell me in short, patients that are curious about it, braces, what's the importance of braces? It's a thing that we must talk about it.
Look, braces, many people think it's more for fashion or aesthetic, but remember, braces are important in function and speech as well, and alignment of teeth, looking after. Let's say you have crooked teeth that you can't even brush and floss properly and clean properly. Braces are there to align, so they're important. The importance of people smiling, extremely important. Braces help with speech as well. If obviously you have things like crooked teeth that will impede on speech, that definitely comes in. So for me, the subject of braces is important, and I know Sunset does a lot of great work on orthodontic treatment, and that's key for us.
You speak of people smiling.
Yeah.
We often complain about mental health problems. One of the positive spin-offs, not just of braces, but of people being able to smile and project positive personalities of themselves out there, which is what dentistry is also important for, is if you smile, if you're positive about life, it actually is good for your mental health.
Definitely.
We don't undermine that. If you can't smile, if there's things that keep you down and you don't have a reason to smile. So, and sometimes knowing that you are doing something about it by actually actively having braces in your mouth, among other things, whitening your teeth, just cleaning your teeth, brushing them every day, you prevent halitosis, and that's our next question. So knowing that you are doing something about your health, your appearance, your self-confidence, just do it. As they say. You must do something about it. It's in your hands.
Yeah, you gotta look after your teeth, guys. Your oral health, smile more. People are all about content creation, and they know that. I've seen so many people in their content creation not being able to smile, and they would reach out and say, hey, I've been taking so many of my pictures, but I can't smile. Can I come to you guys and you can assist? Yes, it builds your self-confidence. It builds your self-esteem as so much. People need to smile more.
Cosmetic dentistry is going to be a need in the future. Now it's nice to have, but it's going to be a need in the future.
Yeah.
And we are all about that as well, among other things. So, bad breath, Doc, before we go and get our COVID updates from Dr. Bonolo Mashishi, just tell me a little bit about bad breath, what causes it, what prevents it, and
So bad breath, some people will call it halitosis, and the medical term for it will be fetor oris. It's a really embarrassing topic for many because it's something that people stop talking, people are afraid to speak because they're afraid that they have a bad breath, or they definitely do. Now, there are many causes, and I never overlook the psychological aspect of it. Some people every day just think that they have a bad breath, but they really don't. And also, people will be like, no, guys, but my breath, I feel like my breath smell. Can you check? And, things like that. But also, because it's multifactorial, that it's caused by many factors. Factors in the oral cavity, which are not limited to, decayed teeth, gum infections, dry mouth, bleeding gums, so many in the mouth, but also not limited to the mouth. We also have ENT problems that can cause bad breath, gastro problems that can cause a bad breath. Certain foods that you eat, they can, release certain gases that can cause bad breath. Infections of the lungs, infections of the ENT, they can cause bad breath. So it's many factors. And the important thing is to visit your dentist so that they can identify your cause of bad breath and be able to help you solve that cause of bad breath. Because many people will ask you, hey, on our social media pages, and also I'm sure you experience that, where people say, hey, I've got a bad breath, how much does it cost to fix it? And you say, look, please come in, let us diagnose you properly, let us know what your problem is so we can know. Because if it's a decayed tooth, then we have to go in and either restore that tooth or extract that tooth, or remove, you understand? And if it's bleeding gums, if it's plaque and calculus or plaque and tartar, as you call it, building up on the teeth, we can help solve that. If it's a dry mouth, we can help solve that. There are so many factors. But for me, the prevention part also is key. People should should be encouraged to brush their teeth, to floss regularly, use oral mouthwashes, and also go to the dentist so we can teach them how these things are done. Also get into the habit of, somebody will say, if I can't afford all of that, what can I do at home? You need to, modify your lifestyle, eat healthy, drink lots of water, and reduce your sugar intake. Such things, they help prevent bad breath.
Yeah, also people shouldn't be disappointed if we refer them to someone more relevant. If you've got a problem with your sinuses, and you've got a problem of infections in your throat that may need the attention of an ear, nose and throat specialist, don't be upset when we say we have diagnosed, we have done our part, but in your advantage, we will actually refer you to the relevant person to deal with the rest of the problem.
Yeah.
But right now, I would like to go viral, where we speak to our clinical virologist, Dr. Odirile Moloi, and she will give us the latest on COVID updates. Over to you, Dr. Mashishi.
So there has been news of a subvariant, BA2, which is different from the original Omicron, which was named BA1. There are other variants or subvariants of Omicron, but they don't seem to show any signs that they cause more severe disease or illness, making people more likely to end up in hospital or die. And this is based on studies and evidence that has been recorded worldwide, including in South Africa. But there is suggestion to show that BA2 has some sort of advantage in its ability to spread from person to person when you compare it to the original Omicron variant. Of course, this information may change at any given time. This is the information to date.
We talking TB. Can we get TB from kissing?
No, unless the person actively is, got TB of the lungs and is sick, and yeah, they can. Technically, but I mean that's not a common.
Don't be distracted. Be scientific. How can we get TB from kissing?
I mean TB is spread in the air, so close contact that is feasible. But as I said, the person has to be sick. If you just have TB lying there in your body, you can't spread TB.
Thank you, Dr. Bundolo, for the ever insightful updates on COVID-19 and other viral situations that we may be facing. Hopefully not for long in the future, but shame when you are staying here with us. You're such an asset of the show and the content that we produce here. I'm still hanging out with Dr. Odirile Moloi, and we are commemorating an important day, which is March 20th, which is International Oral Health Awareness Day. Bruce, thanks for sticking around. The persistent question is, do braces, are they really in fashion or are they really working for people? No. You don't answer for people that you can't answer for, but as far as you know, the majority of cases that you've seen out there, does it look like we are putting braces for people who need them? Or?
Look, we definitely are doing great work with braces. We put in them because they are indicated. It's not necessarily a fashion statement. They are curative. They are there to improve smiles. They are there to correct jaw relations. They are there to boost confidences. And braces are doing a lot of great work, I have to be honest. And the reason why people start thinking that it's a fashion statement is to make them more acceptable and more interesting. Is there's different colors that we put in there, in terms of the color of the rubber bands or the color of the bracket, of the braces themselves. Playing around with color, playing around with appearance. Sometimes we get clear aligners, sometimes we get colored ones. So that's when people start thinking it's a fashion statement, but it is us making them more interesting. But the bigger picture is they are definitely solving the problems.
And our collaborations with influencers make it look like, and the influencers, I can't thank them enough for making it interesting content. They are braces, Jenny. We call them brace faces, whatever. Yeah. But I will tell, we are guilty of such, but I'll tell you, we in order to make oral health appointments doable, and people must find them interesting, and people must say, even if I go for cleaning, I can ask about other things, cosmetics and whatever. It's not about pain only. We don't inflict pain. We don't only deal with your pain. You can go just for a consultation where you make questions about, would any of the work that you do improve my self-esteem? So we say hashtag make smiles trendy.
Make smiles trendy, definitely.
So you can't blame us
no.
for wanting to educate the public.
If you remember, growing up, braces were, people used to laugh at anyone that had braces back then. And we definitely needed to put them out there to correct these smiles, to improve these smiles. Now, they are so acceptable that everybody else feels left out without them. And thanks to the influencers, thanks to social media trends, that we find them very, very interesting.
Now, wires that first, a disclaimer, braces are not used to reduce weight. No. If it's uncomfortable for you to eat because you're wearing braces, some people actually complain after they started wearing braces, they started losing more weight more than they would have expected because there are certain stages where it was uncomfortable. It is not, it's an unintended consequence, and you are not encouraged to use them for losing weight. Let's just be responsible out there. Now, the wires that are supposedly used for losing weight, what's your opinion on that?
Before I get to that, let me just close off the braces topic by just emphasizing also to our audience that many people always mispronounce and say, I want bracelets. I want, there are braces, and oh, doc, can you refer me to an orthodontist? It's an orthodontist. So it's important for people to know the difference between braces and jaw wiring, which is the next topic, and it's a very interesting one. It has been trending because I did a radio interview on it recently as well, and I spoke about it on our social media page as well. So with jaw wiring, it's called intermaxillary fixation, IMF, where we use wires to correct a certain jaw accident from maybe fracturing to fix a jaw fracture to sort of like, correct the problem of a fracture line or something of that sort. So that was used for curative, and it remains relevant. We still use it for curative purposes where somebody was in an MVA or somebody had trauma or somebody fell or bumped on the door and they broke their jaw. Now people are using that to wire their teeth so that they don't open.
Okay.
When they do that, they limit themselves to food intake. They are limited to a...
Supposedly.
Yeah, to a diet which is liquid.
Yeah.
And look, I might sound controversial sometimes because if...
It's fine, Doc.
Look, many of my colleagues still do it because they feel, no, but somehow we found a little bit of it being curative. But let us not confuse it and think that it's losing weight is not limited to jaw wiring. You have to do exercise, you have to change your eating habits, you have to do so many things. And I wouldn't say jaw wiring is indicated because of the dangers that it can cause. The dangers of if somebody had to faint and get into like maybe seizure or something of that sort, it is going to be extremely difficult, and it can result in death because you can't open the mouth to be able to keep the airway safe
open,
and to stop the tongue from going back there, and also to their oral health on its own. Imagine if many of these people who try that habit are drinking all these sugary liquids, and they can't even look after the mouth. You can't brush your tongue, you can't brush your teeth on the inside, you can't perform basic oral hygiene, and that can cause, you might think that, oh, I would have lost weight, but in the process you're also going to lose your teeth. Now, can you afford that?
Doc, I'll spoil it if I say any more. Now, let's talk about debunking myths. We've got about 5 that we need to debunk, and we are relying mainly on social media for these myths. Now we need to, let me find these myths.
I have two that I can come up with while you're still
looking for the audience inputs.
One of the commonest is, I don't have tooth problems, why should I visit the dentist? That's a myth.
That's a myth. Okay, fine.
I don't need to see a dentist. So for me, it's important for you to visit the dentist because there are many problems that are not visible to you. There are many problems that you cannot discover. Only a dentist or a dental practitioner, oral hygienist can pick up through x-rays and through oral, checkups, thorough oral checkups, that they can pick up such problems. So don't think that because you don't have pains, because you think you don't have pains or dental problems, you are safe. You still need to visit the dentist regularly to be able to pick up such problems and to be able to help prevent also certain problems.
The second myth, now it's competition.
Okay.
The second myth is children's teeth don't need to be brushed because they're going to fall off anyway. What do you want to say to that?
Look, children's teeth, I mentioned earlier in the program that they are very important because they help also with growth. If you lose children's teeth at an early age, which we call the milk teeth, if you lose the primary teeth, which is the milk teeth, at an early age, you reduce growth, and then when the permanent teeth, the secondary teeth come out, they don't have enough space to grow. And as you know, children need to eat, children need to chew their food, children need to smile, so they do need those teeth and they do need them healthy.
Children need to stay away from dental abscesses.
Definitely.
As soon as their teeth go bad, they give them swollen gums.
Abscesses.
Yeah, so and then, yeah.
Let me tell you, those abscesses, those swollen gums, they are so detrimental because people think that once the children lose the milk teeth, all of a sudden the permanent teeth come out. The permanent teeth are already in development in the jaw. And if an abscess develops inside the jaw, that abscess can actually cause damage to the erupting tooth, which we call enamel hypoplasia. And the child's teeth, when the permanent ones, when they come out, you are surprised that they are already brown, stained, or they are decayed already, and they just came out. It's because of the abscess that was busy destroying the erupting tooth. That's how important it is to stay away from, to make sure that you prevent such abscess.
Another myth we've dealt with is one that says braces can be used for slimming. No, it's an unintended consequence.
Yeah.
Sometimes it doesn't apply to some people.
Also, let me come in there with another myth that I just thought of now. The issue of brushing teeth. The harder I brush, the more cleaner my teeth will get. Or if I buy a hard toothbrush, my teeth will become more white and more cleaner. We always emphasize soft brushing because the brush bristles can actually cause damage to your tooth surface and cause sensitivity and other problems. You don't have to brush too hard. You need to get the correct technique, which I mentioned earlier, that visit your dentist, let them teach you the right technique. You don't have to get the hardest toothbrush on the market, or you don't have to be the strongest person to brush very hard, because you can cause damage to your teeth with that. Yeah.
And the last myth, Doc, is the one that says dentists have money. The hours we work.
The amount of work we put in.
The problem is my children don't know me in their teen years. I'm hoping I can make it up to them one day.
No, definitely.
If you want to be successful, you have to stay on the edge of your seat, so to speak, and stay in your seat for a long, long time while you are helping other people. Doc, tell me.
Wait, before, can I throw in my last one? Might be controversial.
So you want to win the competition?
I want to win the competition. My last one is, Doc, I pay my medical insurance. I pay my medical
yes.
aid, I pay for
Man.
my treatment. So don't worry. Just
Please
do whatever
repeat that
you want
one,
to do.
Doc.
Doctor, I pay for my medical aid and my medical insurance. They're definitely going to cover my treatment. I tell you. That's when, guys, there's so much that, not to sound controversial, but this is a thorn, There's so much that your medical insurance will not pay. And we as dentists, we don't treat your medical insurance. We treat you, the patient. We advise on treatment that is suitable for you, not that is covered by your medical insurance. So when we treat you as a patient. Don't say, no, do what my medical aid covers. Do what...
No, they don't, it's not even that. Yeah. People don't say, do what my medical aid. Do what I want and what I need. And the medical aid will cover. Just as an informative thing into our patients, the reason why we accept medical aids in our practices in the townships and many black owned practices. It's because we would like to meet our patients halfway. If we didn't accept medical aid, it limits the number of patients we are exposed to. And plus, if our patients cannot use their medical aids with us, it limits the amount of oral health care they can be exposed to. So it's nigga, we are meeting each other halfway. So let's debunk that myth. Don't make demands. And also, it is wrong for us to let you say you can use your medical aid and then I ask cash afterwards. We need to have an agreement before. Have a quotation on the table to say, this is what can be covered, this is what cannot be covered. Are you prepared to pay this in cash? Or would you like to plan for it better so that we can do it another time? We must be open, informed consent, blah, 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 blah.
True. Let me take you a little bit back. CSI, the community one.
Yeah.
As dentists, we also have what we call phased dental treatments. They become affordable because when Dr. K is busy with his ortho treatment with you, he gives you a phased treatment and some form of payment plan, or not necessarily a payment plan, but to say, on this phase, we are going to do this, and let's wait for a later time, and then we'll do another phase. That's part of CSI.
Yeah, anyway, because we work in our own communities. Where can they find you, Doc, so that you can do the work?
Oh, we are on all social media platforms, or most, if I can say. We're on Instagram, Dr. Moloi Dental. We are on Facebook, Dr. Odirile Moloi. We are on Twitter as well, Dr. Moloi Dental. And we have our website, www.drmoloi.co.za. We are practicing at Louis Pasteur Private Hospital on the ground floor, Suite 11.
And all your contact details are
all our contact details are on the website, on social media pages. Please follow us there. We are there, and we are very good friends of Sunset Dental.
Thank you very much. And you are also good friends of Ask Your Doctors, where you can find Dr. Odirile Moloi, as well as all our other specialists and guests who may not necessarily always be doctors. You can find them on our website where it says find your doctor. Their details are on there. And remember to share our content to your friends, whether it's on Facebook, Instagram, or YouTube. Remember to also subscribe. Until next time, keep asking away.